Have you been diagnosed with an autoimmune disease? Do you have rheumatoid arthritis, psoriasis, multiple sclerosis, Sjogren's, Crohn's, fibromyalgia, Graves' disease, Hashimoto's? There are over 80 different autoimmune diseases. If this is you, don't miss the next 25 minutes because I am going to bring information in which is going to explain what is causing your own defense mechanism attack itself. How can it be where my defenses can attack my thyroid to create Hashimoto's, Graves' disease? Or how is it that my defense mechanism is attacking my joints that is creating rheumatoid arthritis? How is it attacking my muscles that's causing fibromyalgia? The sad thing about autoimmune disease is that there are no cures. In other words, there are some treatments. There are certain medications that are going to give you to decrease the inflammation pain, but in reality, there's no hope for you. There's no light at the end of the tunnel because there's nothing to be done for you for the autoimmune disease in medications, right? When they're talking about no cures, we're talking about no pills. Today, it is important for you to understand what is the root cause of autoimmune, and it's going to be inflammation. So we're going to talk about where are the most common areas that your body is creating systemic inflammation that is providing that life of that or the confusion per se of your defense mechanism attacking itself. I'm going to explain to you what can we do to restore your systems, or what systems are dysfunctioning that's giving me inflammation. In other words, we are going to look at the root cause of a lot of the autoimmune dysfunction that comes from inflammation. And we are going to be talking about your digestive system, in which plays a huge role in this dysfunction. So let's get started, guys. I am Dr. J. I am a doctor in which we have provided and created a system. Okay, it's called Imagine Wellness System, called the IW system, which we're going to be going over. And what is it that I can do for you different to get to the root cause? But not only that, how can we restore your own body to stop creating inflammation that could be causing a lot of your dysfunctions, your autoimmune, in which there's no pills for, and you have no hope to restore. So let's get started. We are going to jump right into things. I am going to be using my slides here right quick. Let's get going, guys. Again, I am Dr. J, Imagine Wellness Center. I am in San Antonio. That's where my base is, but I do work with clients all over the nation, and we have such great results. We have an online system that is prepared for you just to provide for you the information of how to restore your body step by step, okay? Online, in which you will get and restore and recover. Not only that, what can I do for you to teach you and educate you that once you create healing and restoring within your body, how can you continue getting that? There's an urgency to understand that. So I am going to explain that to you right now. All right, so let's start. Let's get rid of a lot of distractions that you might have. If you're not using your phone, put it aside, put it on silent. Let's really get started and get educated. Get a pencil, get some notes, and we get going. All right, so again, I did talk about autoimmune disease, inflammation. Where does it begin? What is autoimmune disease? If you don't know what autoimmune disease is, basically saying that your own defense mechanism has gone rogue, okay, or it becomes confused and is attacking your organs. Okay, that's whatever organ is attacking is the name of the disease you should be getting. But again, what is creating my own body to attack itself? It doesn't make sense. So what's happening here is this. Your body has such high inflammation that your own defense mechanism is becoming confused to attack itself. And that's what I want to explain to you. Where is this system coming from? Where is this inflammation and how is it happening? Right? Now, I am going to talk about the digestive system because I believe that those are the areas in which the dysfunction begins. Most of my autoimmune patients are going to deal with a lot of digestive issues. So if you are dealing with hiatal hernias, GERD, you might have diverticulosis, diverticulitis, polyps, you might have hemorrhoids, you might have, IBS, ulcerative colitis, you might have all these different dysfunctions. That could be the beginning and the disruption of the lining of your gut, which creates a thing called leaky gut or permeability of your gut, in which from that, your foods are going to be the biggest problem. Who would ever thought? Okay, and it's not about nutrient value. Okay, who would ever thought that my foods could be affecting my inflammation patterns in my life, right? Well, that's what I want to explain to you, and I want to make sure that you understand how important the digestive is, okay, and how that is creating a lot of this inflammation, which is coming from your foods that it's not about nutrient value. Okay, you'll understand that if you're eating very healthy, you can still have an inflammatory responses from those healthy foods, just as well as you have some from those dirty foods. But let's begin. Let's talk about the responsibility of your gut. Where does it work? Leaky gut. How does it affect my body? Where does it affect it? And this is the reason why it's affecting you all over the place. So it's going to be affecting the sinuses in the mouth, the adrenals with the fatigue and tiredness, right? Rheumatoid arthritis, fibromyalgia, headaches. Okay. How about depression and anxiety, ADHD? You have eczema. You're going to have psoriasis, right? You're going to have a variety of different skin dysfunctions. How about Hashimoto's grave disease in your thyroid, constipation, diarrhea, IBD, IBS, all these different dysfunctions, all right? So again, I just wanted to show you here that your digestive is the portal entry into your life. And if that's not working right, then you're not working right because it's affecting a variety of different areas. Okay. Now, the concept that we use on the IW method is that we want to get to the root of your dysfunction by identifying systems dysfunction. Okay, not chasing your symptomology. You're not going to hear today of me trying to sell you a supplement because this is not about a supplement. This is about restoring your body so you can take care of it, so your body can take care of itself and start decreasing your chronic diseases, not just necessarily autoimmune. Anything that you might be dealing with, high blood pressure, you might be dealing with diabetes, variety of diseases, we want you to understand that if these systems are working and they're worked on to make them work right because they're integrated with each other, in which you're going to learn this today, that there's a lot of systems, right? So the systems that I work and really the platform, the fundamentals that I use is going to be your digestive system, which we're going to be talking about right now, your circulatory system, which is going to make sense to you here in a minute, your endocrine system, and your neuroendocrine system. These are the systems in which I concentrate to restore, in which we're going to concentrate today in autoimmune, that is going to make sense to you that these systems are integrated with each other and they're not individual pieces. And as you see, it's not just your digestive. It affects everywhere else. So again, I want to make sure you understand that. So let's jump right into the leaky gut or the permeability of your gut. How does that work and how am I getting that? Dr. J, how is my gut disrupting? Why am I having all these problems? I never get healed. I'm always taking medications for my digestive system. Well, let me tell you, we got to remember root cause of dysfunction. And right now we're talking about one of the systems that are very important within my system of healing, right? We're not chasing your symptoms, right? We're not chasing the acidity in your gut that's giving you acid reflux to take Nexium to calm it down, right? That's just a substance to decrease your calcium so you don't feel the acid. But in reality, there's a disruption in the lining of that stomach or the digestive system that's creating inflammation that's changing my acid, right? My internal liquids, it's changing it to different things. So again, those are the things in which we're going to be talking about right now. Now, there are certain triggers, okay, that is the lining of the gut. There's certain triggers that destroy the tight junctions of the gut. Okay, and the triggers you have them up here: dietary proteins, low hydrochloric acid and enzymes, antibiotics, infections, sugars, antibodies. Now, let's talk about hormones, right? Some of you might be in, pregnancy could have destroyed the lining of your gut. How about stress, cortisol, right? That's not big right now, it's huge. How about menopause, toxins, food allergens, right? How about parasites, candidas, H. pylori? There are certain triggers that are going to destroy the glue, the tight junctions, especially in the small intestine. Now, when this trigger destroys that glue, that's when the problem begins, because now I have permeability or I have leaky gut that connects my digestive system, which is a very dirty bacterial system from the external world, to my purity of my internal world of my blood. See, because blood is your life. And God has created this blood to keep it clean and restored, because that's what keeps you alive. So your body has a system to clean it up. Now, let's zoom in and let's talk a little bit about what's going on with my leaky gut and permeability. How is this creating inflammation from my foods, okay? And it's causing my problem in my joints, in my thyroid, my gut, anywhere where it's attacking it, right? How is this creating autoimmune disease? How is this creating such high inflammation? And how am I getting all these diseases? And it's starting with this systemic inflammation, right? Now, Let's say that you are going to eat a food. Again, remember, it's not about food nutrient, right? Not about the powerful foods. It's about any food that can leak through that permeability of the gut and lands in your blood, and that's where the problem begins. So let's say that if I eat, let's say any food, let's take a carrot. If I chew a carrot in my mouth, I break it down in my mouth, it goes to my stomach, it gets broken down further, it goes to my small intestines, right? It gets absorbed through the villi, those fingers like you see here, villi, microvilli, those nutrients goes into the cell, gets into the blood, and gets a carrot, they carry it to wherever you need it. Now, that's what happens with all your foods, guys. It's more complex than this, but I'm trying to make it happen where we can understand ourselves in a quicker and an easier way. Now, what happens though, if my carrot, instead of going through the right absorption, it leaks to that permeability of my leaky gut and it lands in my blood. See, that's a problem. It came to the wrong pathway, it's landed in my blood. Now you got dirtiness in my blood. We got to clean that up. Your body has an awesome defense mechanism to clean it up. Let's talk about this, how your body cleans this blood out. Let's talk about two ways of attack. Again, it's more complex than this, but I'm trying to make it as easy as possible to understand. Let's call these T cells. And these cells, all they're doing is monitor your blood. They come to something that is not right? That is not good. They don't know what a carrot is. It's a chemical. They see it. It's bad. They need to destroy it. They need to clean it up. They need to kill it. So what they do is that they go to this carrot and they put a flag to it. He marks it. And from there, it creates a memory. From now on, every time you eat a carrot, it comes with a flag. Just like any kind of like the flu shot, right? If it comes into your blood, you flag it down, they create a memory, and now every time the flu comes in, your body just immediately attacks it. Same thing with your carrot right now, okay? Now, it's marked, right? It's created a memory. From now on, carrot comes, it needs to be flagged down. Now, the second wave of attack to destroy this flagged carrot or the flagged substance is going to be your killer cells. And your killer cells, all they do, let's say, they just monitor your blood and they get to all the flags that are marked and it destroys every flag that is marked, all right? So, but when the destruction of this carrot, all right, on these flags that is marked, you're going to stimulate a thing called the circulating immune complex, right? The first thing you're going to create out of that is inflammation, right? Remember, what causes my autoimmune to be so excited is inflammation, but if nobody's beat me on the head every day to create inflammation from trauma, then I'm creating the systemic inflammation. And right now, I just created inflammation from a carrot. Who would ever thought that I could create inflammation from a good nutrient that's like a carrot, right? But yeah, I just did. So therefore, I created inflammation. It crosses the brain barrier. Remember, I just created autoimmunity. I created that memory, right? And then you're not getting the nutrients out of my carrot. You're not getting the nutrients out of your foods. So this is what's going on right now in inflammation. So if you've had all these dysfunctions in digestive, felt it or not, okay, and your body has flagged, let's say 20 different foods, because if I ask where you eat, or where do you do your shopping? You probably shop in the same market, same aisle, same brand of substances, right? And you have those all in your house, in your refrigerator. And you're eating those every day, 3 times a day. Every time you eat those substances that have leaked through the leaky gut, like the carrot, you are creating a flag, and now you're creating inflammation, right? So again, inflammation. So you have tons of flags in your blood, okay? You have tons of flags throughout your day. Your killer cells, let's say that our army of cells that destroys this stuff, you're getting a lot of it through this blood flow. So let's say that your killer cells comes to destroy these flags, okay? And it starts killing these flags. One thing you're going to create is tons of inflammation, right? Because that's the circulating immune complex. But let's say that they don't destroy all of those flags. And half of those flags will go through your blood, and they're going to go and they're going to land somewhere. Let's say that they land on your joints, okay? Eventually, within time, your killer cells are going to come destroy those cells. Why? Because they want to keep your body healthy, and that's what's going to happen. When those killer cells comes to attack those flags in your joints, the confusion happens this way. I'm going to give you a little bit of a picture of a visual of how this happens. If I plant a few rows of carrots in my garden, okay? I go away for the next 3 to 5 weeks. I come back and I find my carrots full of weeds. I want to pull out my carrots, right? I want to clean my carrots. I want to make sure that I pull out those weeds, right? I start pulling out those weeds, but I can't tell the difference between my carrots and my weeds. And before you know it, I'm killing my carrots. I'm pulling them out. I didn't want to do that. See, this is what's happening in the confusion with all of these flags in your joints. You're going to have flags, good cells, just like the weeds and the carrots. When those killer cells come to destroy those flags, it's going to destroy those cells also. Just like me pulling out my carrots. Now you are destroying the cells in your joints. What is that called? That's called rheumatoid arthritis, right? Because that's the attack of those flags. If the overflow of those flags are in your muscles, that's what you're going to call fibromyalgia. If those flags are going to be a lot in your thyroid, that's what you're going to call Hashimoto's on the hypothyroid to decrease the production of the thyroid or increase the production of thyroid called Graves' disease. These are the flags. This is what's causing the confusion of your own body attacking itself. Guys, it could attack anywhere. There's over 80 different diseases. There's no pills for it. But what can we do to help you? Because look, if you have these flags, let's say in your pancreas and your organs, then you're gonna have what? Diabetes type 1, right? It's an autoimmune destruction of the what? Of the cells in your pancreas. Now you can't produce insulin. So again, it begins to attack anywhere, and there's some really serious autoimmune disease out there. You might be dealing with one of those, and I tell you, I've seen some really nasty stuff, especially pemphigus, a lot of these different things where it is amazing to see these people are suffering, and yet there's not much that we can do. So now we're finding out what we can do different, right? What can I do for you to decrease these inflammatory responses, right? Well, first of all, I have to identify the trigger. What is destroying the lining of my gut? Secondly, I can restore the tight junctions in the gut. We have an awesome way. The last 15 years, we've created an awesome way to really restore the lining of the gut for sure. Okay. Now you're not creating more flags, but now we got to get rid of the flags, right? Because listen to this. It is logical to think that if we can identify those foods or those flags that are in your blood that are traveling all over my body that's creating all this inflammation, wouldn't it be awesome if we can identify them and get them out of your system? And if I can get those foods out of your system, if I can get those flags away from you where you're not ingesting them anymore, then you're not what? Your defense mechanism is no longer attacking those. So if I get rid of the flags, right, and your body no longer attacks your joint, that's where you're going to have the decrease of inflammation. That same way with the thyroid, it's going to decrease the thyroid. Again, anywhere in your body, you're going to see the decrease of the autoimmune. Because look, if you have one autoimmune disease, you're going to create 2 or 3 autoimmune diseases down the line. Why? Because it's the same mechanism of onset. It's the same mechanism attack. It's the same flags. Anywhere it goes, it's going to attack it. So this is the reason why I am bringing something really new to you. I hope this is making sense to you. I want you to know that what we're going to be doing in our office is that we're going to be looking at blood tests, right, of what those flags are in your blood and move them out of your system, right? Why? Because now you have no flags to attack. Now we decrease the inflammation response. And we'll tell you how we're going to work with that. How do we get rid of those flags? How do we bring those foods back? All of this is really a process of understanding. That's what we're doing. So if I'm talking about a system, right? We spoke about system dysfunctions. Right now, I'm talking about how your digestive system, okay, is affecting your circulatory system, right? And some of these triggers are even in the endocrine system. So if I go to the stress, okay, in your cortisol, which comes from the adrenal glands, your endocrine system, that is destroying the lining of my gut, that's affecting my digestive system, then now it goes into my circulatory system. Do you see how those are together? So this is the connection that I want to bring to you, that it's not just finding these flags, it's not just doing a test, it's identifying root cause and the integration with all these systems that are working together to make things good for you. I hope I am bringing you a little bit of understanding of what we're going to do, guys. And the next thing is, again, I would love to work with you. This is really, in reality, guys, a huge, my first patient is RA patient, has great results. And since then, we've been helping thousands of people know that there is hope for you. And by just making sure to understand the physiology and function and stop searching for a pill, let's start motivating ourselves to move forward and really start doing it ourselves. But the information out there is ridiculous, right? There's so many things out there, right? The diets and all these different things. Listen, guys, if this systems of disruption, I don't care what diet you do, it might help for a little bit, but it's not something that is concurrent to go for a long time to get you healthy. Very important. Quickly, I am going to talk about the thyroid a little bit, just because most patients who are dealing with my autoimmune are also dealing with thyroid dysfunction. Your thyroid, okay, is going to have a variety of different symptoms, and your thyroid, okay, affects every cell of your body. And in fact, if you have certain symptoms, and again, your doctor's misdiagnosing it. That's the most misdiagnosed gland. 90% of people, most of the time, is misdiagnosed on the thyroid. And you are going to have a variety of different symptoms, from hair loss, right, to tiredness, fatigue, mood swings, right, your depression, right? That's the big issue. Insomnia, right? A lot of these are interconnected and concurrent with your thyroid. And if your thyroid is not working right, then you're not producing the substances to really produce the adrenals that's going to give you, or your adrenals are hyperactive, especially with my PTSD patients, adrenal dysfunction, you can fall into and stay asleep. You're always on the fight-flight response. So again, thyroid plays a huge role. How about diet? If you are overweight, tired, sluggish, everything that we just talked about, you're doing diets, you lose 10 pounds and you gain it in the next 3 to 5 meals, that means that your problem is not a food consumption imbalance. Your problem is a chemical imbalance from the thyroid. Okay. So again, the thyroid, let me explain to you the thyroid quickly of how that works and how most doctors diagnose that thyroid. The way it makes sense, because I'm talking about, misdiagnosing the thyroid, I want to make sure you understand what that means. Okay. So again, what does that mean? Let me quickly tell you how your doctor is diagnosing your thyroid. Your doctor is going to check a substance called TSH. Okay. So TSH, let me go here. TSH is a substance that's produced by the pituitary gland that tells your thyroid to produce T4. Thyroxine is a hormone. If you are decreased in function of T4, it's called hypothyroid. If you have too much T4, it's called hyperthyroid. If you have low T4, solution is going to be a medication called levothyroxine or Synthroid, which is going to elevate your T4, and that's your doctor's solution. Hyperthyroid, not very many medications to bring it down. And if you're dealing with this, we'll talk about autoimmune in a minute. Again, hyperthyroid, the solution is to get rid of the thyroid. I have tons of patients that come in with no thyroid that has said, hey, listen, they took it out because I had a hyperthyroidism, right? That's not your solution, all right? But again, when you decrease that hypothyroid or get rid of the thyroid, you become hypothyroid, right? Because you're no longer producing T4. So now they give you the medication, levothyroxine Synthroid, and other compounded medications to increase that T4 again. But then you're going to take those medications forever because you no longer have a thyroid. But as a matter of fact, you still have the attack to the thyroid. You haven't got rid of it. So you're just getting rid of the thyroid because it's giving you symptoms, but it's not the solution to your autoimmune. That's the reason maybe you created cancer, nodules, all these functions in your thyroid, guys. So let me quickly tell you how is it that most doctors are misdiagnosing. So your doctor just checked your TSH and T4, but he's only checking here to here. Because the T4, remember, the thyroid hormone affects every cell of your body, but it's not T4, the hormone that your thyroid is producing. It's actually T3. And T3, your thyroid produces just about 7%. That T4, okay, is converted to T3, 60% in the liver, 20% in the digestive system, 20% becoming active in other tissues. So most likely your dysfunction, if you are having a thyroid problem, you're taking medications, your doctor says you're completely normal, but you got all the symptoms, it means that your body is not converting T4 to T3, and your problem is not just the thyroid, your problem is that your liver and your gut is not working right. That is huge, guys. For some of you guys who are dealing with thyroid, and maybe you've been misdiagnosed, this is the secret. We need to know what the T3 is doing. We need to know what the free T3 is doing, and this is what I'm bringing to you in the information. And I'm just wanting to talk about the thyroid because digestive people have huge problems with thyroid because you're not converting T4 to T3. My high blood pressure, my liver dysfunction patients, you're not converting T4 to T3. So let me give it to you in a little bit of a different angle. The T4 that thyroid is producing is gasoline. Your engines are diesel. The gasoline doesn't work for you in your engine. It needs to be converted into my diesel. That's my T3. My gasoline, I need it as a raw source to create my diesel. Without it, I can create diesel, right? So my T4, okay, goes to the refinery, which is the liver, and gets converted into diesel. If my liver is, I don't care, you can have all the gasoline you want, but if you're not breaking it down into my diesel, then I don't have my fuel that's going to fuel my cells to function correctly. And this is the reason why you have all the symptoms. I'm losing my hair, I'm overweight, I'm very tired, sluggish, emotional, all these different things is not the problem because you don't have enough T4. The problem is that you don't have enough fuel to run your cells. Same thing with your digestive system. And we just spoke about it, right? Now, that is a conversion of thyroid. This is the reason why most of you guys have been misdiagnosed and you need help. I can provide information according to your specific needs of individual testing and tell you exactly where your problem is. Is it in my pituitary gland, my thyroid? Is it my gut? Is it my liver? Guys, I'm bringing you so many different things that maybe you've never heard before. The next thing is, how did my thyroid not produce enough? Okay, we're not talking about metabolic breakdown of the thyroid hormone now. What is my thyroid not producing? Well, 90% of the time it's not producing because what? It's an autoimmune disease. Didn't we just talk about Hashimoto's and Graves' disease? If my flags are in my thyroid and it's attacking my thyroid, what does that mean? It means that the gland either decreases production, that's going to give me what? Hashimoto's, which is hypothyroid, or increases production from the attack. That's what you call Graves' disease. See, it came from an autoimmune that started where? My flags, from leaky gut and triggers to my digestive. They created those flags in my blood that now it's all over my body. This is the reason why I'm telling you guys, there's a lot of information out here. And again, at the end of the day, we feel like we're not getting ahead, right? We got to do something different. I'm a true believer that a lot of times we do the same thing over and over again. One, because we don't know what to do. Secondly, right, is because we don't know. We're just expecting different results, right? So what is the name when you do everything, or again, you do the same thing over and over again, expecting different results? What is that? When I do something over and over again, expecting different results, it's called insanity. If this is making sense to you, it is time to do something different. Because out there, guys, it's all about the money. It's all about your treatment. If there's no treatment, it means that there's no money. Wrong and lack of information. What is our health system doing to help us? It is corrupted and dysfunctioning to its core. Everything that controls is money. Look at vaccines. Look at all these things that's going on today in today's world. It is ridiculous. It's time for us to stand up to ourselves and start saying, it's time for me to take care of my body so my body can take care of me. And stop relying on a capsule, on something that is going to change and just patch my symptoms. Pharmaceutical companies are just killing it right now. How about insurance companies? Your FDA, our government is supposed to be taking care of us. Guys, we're living in the most dysfunctioning crisis in all times, and especially in our healthcare. And we have most of the sickest people ever. Autoimmune dysfunction with COVID has been the biggest problem that we have. I can go all day talking about that, guys, but in reality, I want to stimulate you to think that, you know what, God created you for a purpose. And that purpose, maybe some of us will go to our graves without even knowing what we had to do. And some of you are so sick that you can't even provide the purpose of your life, but really what you were created for. Are you living life? Listen, we all have a why we want to why we want to live, why we want to get better. You know, to me, my family, whatever it might be in your life. It's important for you to create that why so you can really reach the purpose. And if you never create a why, you will never move forward into changing your life. And if we keep doing the same thing over again on a system that is not working for us, let's try something different. I'm giving you an opportunity to really change your life. What do you have to lose? Nothing. Besides giving a consultation, and let's see if Dr. J's got the answers of what he's talking about and what can that affect your life. How can we change your life? How can we reclaim that health that you always wanted to be? This is what I'm looking for. So you bring that why, and we'll show you that how. You will reclaim your health, and you will restore the systems that are giving you all these inflammatory responses. And I know you'll get better because I've seen that done thousands of times with thousands of people. Okay? So again, I am imaginewellnesscenter.com is my website. You guys can go in there and see a bunch of testimonials, especially like Penny here. You might relate to her. Hashimoto's Graves' disease, autoimmune to her thyroid, nodules, getting ready to do a surgery, overweight, depressive, hair thinning, every symptom that you can think of, poor lady had it. Okay? She took the chance of really educating her and providing the services by identifying those dysfunctions in those systems. And I'll tell you what we're going to be doing for you here in a minute. But I'll tell you what, 3 months later, she lost 30 pounds. I mean, no more thyroid surgery. This is what the picture you'll see on the testimony room. And she is living life today, right? Why? Because we educated her. And he did the steps. She followed through, and she was motivated to change her life. These are the results that maybe you relate to that I would love to do for you, or help you to get. Okay? And this is Penny. So again, guys, I'm almost done here, so stay with me. I'll tell you about how to get a consultation here in my office. I'm going to give you an awesome discounted price. We'll talk about that here in a minute. Or also, we have an awesome system online. We can do our testing. We can provide every information online. You can do it either or. I got all of those set up for you. We have a system that you can follow step by step online, or if you want one-on-one with doctors, we have that for you too. But again, let me tell you the platform we're going to use quickly of how we're going to get you restored. All right. My system is going to be based on 4 pillars of health. Okay. These 4 pillars of health are going to be the fundamentals in what we're going to get through them. I'm going to go over them just quickly so you'll know what I'm talking about. In nutrition, we just spoke about nutrient dysfunction. Okay, yes, nutrient value is important because that gives us, energy, provides growth, and really repairs the tissue. But if that food is what's causing the inflammation, you're never going to get restored. That's the reason why we got to clean that up, and nobody's the same. This is not a cookie cutter. This is going to be individualized to your specific needs. And from there, we get started and help you. Our nutritionist, myself, we have awesome ways. This is what the blood work is going to indicate to us. This is not an eliminating diet or anything like that. We're going to know because it's telling us from the blood. Simple as that. Okay, so again, nutrition is huge. We are going to talk about how to restore, get rid of a lot of toxins, metals, dysfunctions, environmental factors from the liver and the gut, because without them, you can't work. We have an awesome way in the last 15 years. We really researched every way, every level to really reclaim the health of your gut. For some of you who are dealing with gut dysfunctions and some of you who are dealing with liver dysfunctions, we're really going to be working on those and restoring, detoxifying, and repairing. Okay, hormones. Hormones are huge. We just spoke about the thyroid quickly, but how about sex hormones, right? How about adrenals, right? I'll talk a lot about it to my PTSD clients. A lot of the neurotransmitters are there also, right? How is my dopamine, serotonin, GABA? What is giving me depression, anxiety, PTSD, all these different things? We're going to identify those, right? And it comes down to some of these neurotransmitter checking and hormones and how the systems integrate within each other. If your hormones are out of place, guys, you're going to be out of place. All right. So again, that's that. And then we are going to be talking about exercise and fitness. You guys, you have to move. Whatever you say, get out and do something. Walk around, do the exercise. Because listen, I know that you're tired and sluggish and you might have pain. But at the end of the day, that's what we're trying to do here. We're going to recover so you can start doing the things that you love to do. Because if you're walking your dog like this, it's unacceptable. You are not living life. You're sustaining life. It is time to live life. Give us that opportunity to show you and really get you to a point of health. Okay, by really identifying the root of the dysfunctions and how can we get you to exercise, how can we get you to create strength, and that's going to be essential. For some of my patients, I also check genetics, and we do check the epigenetics through the genome. What are the mutations that mom and dad gave you that could be causing the dysfunction in these systems? Not only that, how can we suppress activation of this expressions, right, through epigenetics? So again, I do have that there, guys. It is really awesome tool that a lot of people are not using. We have this. So again, I can go any deeper into the root of your dysfunction, the genetics. Okay, but at the end of the day, though, the concept is that I got to put this together. I got to create that foundation. Those pillars got to stand, right? We're going to look at you as a whole, not just individual parts of where your symptoms are, or is it just your rheumatoid arthritis and your joints? We're not going to concentrate on the joints. We got to concentrate on the root of the problem, right? Again, this is the reason why these pillars of health got to come out together, and you have to do all of them. Right? We do have a system that works. 94% of people don't have a system. We have an awesome system. And that's why the reason they failed and we're so successful. I would love to help you, and I would like to tell you how you can get a consultation in my office. I hope that this presentation made sense, and I hope that we get to the point that we can change your life. So therefore, are you willing to do something different? This is my question to you. Let's get started. I would love to help you. Let me tell you now how you can come for a consultation. In our office, what we're going to do is that we're going to give you 1 hour of consultation. Through online, wherever you're in the world, we can bring it to you. Okay? We are going to provide some information for you to fill out, and that's going to dictate what systems are dysfunctioning so we can create a case according to your dysfunctions, age, everything that you provide from that information. Okay? If you have any labs, make sure you send them to us, because that way we can paint a better picture of what can we do, where do we need to restore, what systems are dysfunctioning within you. Again, in that consultation, all right, we are going to talk about, what lefts to run, covered by insurance, not covered by insurance. How would you prepare all that? Okay, is it covered by? Again, can you afford it? Because remember, what we're doing here is we're doing the walk with you until you achieve your goals. This is not you coming into my office and taking supplementation. No, it's about restoration of the system and supplementation with a purpose. Okay, I'm not giving you a supplement for your rheumatoid arthritis. I'm giving you a supplement that is going to repair and restore what we need to restore in the systems. So again, it is very important to understand that. All right, it goes by time, 3 months, 6. We're going to go 4 months. I know that that's one of the optimal goals for me, is restore your body in those 4 months. So again, we do have those for you. Can you afford them? Most definitely. Okay, we got ways of payment. We have different things so you can afford them. But again, at the end of the day, though, is your motivation to change. We'll give you all the tools to get there. but it's time for you to take action. All right. The price of my consultation are $287. Since you've been educated in the last 30 minutes, then I'm going to provide that consultation, and I'm going to give it to you for $87. Call us to get a consultation. I would love to help you. All right. That's it for me, guys. Thank you for listening. God bless you, and hope to see you again.